Hello, welcome to Numa Yoga. Today we're working on yoga for Jiu-Jitsu. This is about building hip mobility today. Now, what's important thing about mobility is that it takes awareness, it takes practice, not so much force. So with today's practice, what I want you to embody and start to think about is to move slow and to move smooth. Awareness, patience, and persistence will get your body to move well. All right. All you need for today's practice is just some space and a comfortable mat that you can move around on well. I got lots of space here with me. I hope you do as well. You can always hit that pause button, clear the space, find a comfortable room where you're ready to go, and then let's get started with our practice. Today we're going to start in a tabletop position. So coming shoulders, hands, knees, and hips in alignment here. And just begin to practice and start rocking back and forth. Rocking through your shoulders, through your hips, untucking your toes, tucking your toes. Just starting to move through your body. Just letting the spine float over the mat, hinging back and forward through those hips, through your shoulders. You can really feel as you sink back, think about relaxing your back, relaxing your glutes, relaxing the knees. Right, and one important thing too when you're trying to build more mobility is that you can't force it. You can't like push through pain. So if this starts to hurt, that's just going to cause bracing, and actually it's going to lead to more tension. So what we need to do is to start to move through what feels good, pausing right at that edge of what's comfortable, breathing smooth in there and back and forth. Good. Now let's come back to a neutral position here, shoulders over the wrist, knees over the hips. On an inhale, you're going to bring the head up. On an exhale, tuck the chin down. Rounding the back, inhaling, lifting the head up. You'll feel an arch into your back and exhale. One more time, inhale through the nose. Exhaling, drawing the belly in. Good. From neutral here, we're going to bring our right leg into this. So on an inhale, lifting the head up, lifting the leg up. Engaging your glute, your right glute, and then exhale. Engaging the right side of your core. Inhale. Engage the right glute, the right low back. Exhale. Engaging the right front side of your body. Inhale. Exhale. One more time. In. This time you're going to step the right foot outside the right hand. And we're going to rock back and forth. So hinging back and forth a few times on that back knee. And again, just going into that comfortable range of motion for you, right? You only go to that distance that you're not straining your muscles, you're not forcing your muscles. We're really not even that warmed up yet, so don't pull too hard on your body to get it long. That's not how it works. Muscles need to learn. They learn mobility, right? We let go of tension. Teach our body to move well, to breathe well. Good. A few more times back and forth, just gliding, trying to move nice and straight forward and back. Good. Let's bring a twist into this. So the next time you come up, you're going to plant the left hand down. You're going to reach the right arm back, grabbing over the right foot. Towards the blade edge of the toes, and look up towards the ceiling. Try to stay flat on your feet here. I know it's easy to kind of round into this. You can do a little rocking here. Be nice and still. But wherever you're doing, you want to be able to breathe nice and easy through the nose. Light, smooth breaths, a few more. In and out. Right, that perfect breath is 5 seconds in, 5 seconds out, low and smooth. Good. Placing the back foot down. Placing the right leg back down, and then sink back towards the child's pose. 2 breaths in here, this nice deep breath down towards your hips. And exhale. Imagine your breath is even originating down the base of your body. As if you're breathing from your hips into your hips. And exhaling, letting it go. Good. Then coming back up, table position. On an inhale, head's gonna come up, left leg comes up, left glute engages. Exhale, knee in the chest. Inhale, head and leg up. Exhale. Inhale. Exhale. Inhale. Good. This time, when your leg comes back, you're going to step the left leg by the left hand. Rock back and forth. Hinging through the knee, nice and straight. Sinking back into your hip. Get a good lengthening in the hamstring in the back of the leg. Or this front leg, obviously in the back of the leg, your front leg. Good. Move smooth, move slow. And I'm moving even a little faster for myself. I like to go real slow typically. No need to rush anything, you're just paying attention. Not straining, not forcing, gliding. All right. Next time that you come back up to the top, gonna park it right here. You're gonna twist, plant the right hand down, bend the right knee, reach back towards the pinky side of the foot, twist and gaze upward. But you don't have to be still here, but you do gotta breathe through your nose, nice and smooth, light and easy. Still imagining that breath to breathe low into your body, right? We want to imagine our breath is originating from below the navel center, behind the navel center. Breath goes into your hips, into your low back, light and smooth. Good. You'll lower the foot down. You're going to place the hands back down on the ground. Step that foot back. Come back to child's pose. And rock side to side here. So rolling over the femur bones. Stirring into your hips. Roll left and right. Feel that in the sides. Deep into your hip sockets. Sides of your legs. Backs of your legs. Good. Now from here, we're gonna step into a seated position. So into this staff pose here, you can walk your legs through, coming right into this position like this, sitting nice and tall. This is a great practice to sit here for 10, 15, 20, 30 minutes. Great way to train your spine to be straight and tall. We'll just be here for a moment. Bring your hands together at your heart center. Sit nice and tall. Inhale, bring your arms up. Exhale, arms behind the head. Inhale, arms up. Exhale, hands heart center. We'll do that 2 more times. Inhale, up. Exhale, hands behind the head. Inhale, hands up. Exhale, hands heart center. Inhale, hands up. Want to build a strong, tall spine, right? There's no hip mobility if the spine's all kinked up. Exhale, hands down. Inhale, up. Exhale, hands down. Good. Place the hands at the side. Bend your knees, place them about shoulders, hips apart. Spin like this so you can see here. And we're just going to do this rotation side to side. Roll in the leg bones, bring in the The following leg, right, this back leg, trying to rotate so that knee can come down, roll through your hips, side to side. You could have your hands supporting you on the ground here, or you can have your hands up off the ground. A few times. Not forcing it, right? Not straining to bring this hip to the ground. Just rolling in. You may notice one side's easier than the other. Easier to move in one direction, right? We have a smart side and we usually have a stiffer, less intelligent way of moving, right? Especially if you do Jiu-Jitsu, you're gonna notice that you're definitely better on one side than the other. Good, okay. Now let's bring back to center. With these legs, you're gonna place the soles of the feet together, bring your heel in towards your seat. Hold the feet together like this. Scooch back just a bit, just still in frame. We're gonna butterfly. So not forcing the legs here, not straining, just rising and lowering, fluttering. Focusing at the sensation at the base of the spine, flutter up and down. Do this for about a minute. Sitting nice and tall, right? We are focusing on building that long, tall spine. Our body is always going to be in tension if our spine's kinked and bent. We're always going to be stuck in pattern habits of tension and pain. So spine's the most important. If you want mobile hips, you got to work on your spine. Everything in this body is connected. Tension one place leads to tension somewhere else. Keep your breathing smooth through your nose. Stay relaxed and at ease. Try to breathe light and slow. Just fluttering. Just fluttering. Excellent. Nice. Now, you're going to keep this right foot, going to let the left leg go long. Going to take your left arm, catch that around the outside of the leg, hold that in, interlock the hands. You're going to bring that foot towards your chest. You're just going to rock, stir, side to side. What you're trying to do is feel this hip down here, just kind of move and unglue from all that fascia that's holding it onto the pelvis. I know I keep saying that we want to not force and stretch our body, so if your leg's out here, it's out here. If you can just hold it like this, you're just holding it like this. The more you bring it here, right, the more you work on this, the better your mobility, the easier this will become. But we can't stretch fascia. That stuff that's gluing your hip onto the pelvis, stuff that holds your whole body together, it doesn't stretch. We need to get it to glide and slide. And we need to re-educate the muscles so that we just move with more intelligence. That's all it takes to get that, right? Just the consistency, showing up for ourselves every day. Nice work. Rocking that side to side. Staying tall, breathing well. A few more times. Relaxing into it. Relaxing into it. Good. Now let's bring the right leg down. Bring the left leg up. Remember, if it's just here, it's just here, right? If it's too hard to get this arm around and catch that, then that's all right. That's where you're at today. With practice tomorrow, it'll be a different story. Right? As long as we keep showing up, differences will be made. Good. Breathe. Not force, not strain. Gliding. Nice work. If you can maintain that 5-second in breath, 5-second out breath. Okay, 3, 2, 1. Nice work. We're gonna slide that left leg back down. Okay, so now from sitting here, we're gonna come back onto our back. And like I said, we gotta do a little bit of the spine to release from the hips. So interlace your fingers behind your head. Let your body rest long on the floor, knees pointed towards the ceiling. On an exhale, you're gonna bring your elbows up, and then exhale again, curl up. Slowly inhale, come down. Open the arms. Arch your back when you land. So you land, you arch into your back. You come back to neutral. You exhale. Flatten the belly, curl the arms, and curl up. Slowly come down, release real slow. Breathing in as you come down. Arms and elbows open last. When you land on the ground, you inhale and you arch your back and the tailbone taps down. So this is a somatic arch and curl. Typically you do these real slow, full of awareness. Nice. One more time each direction. So the arch is the extension in your back. You relax the extension, and then exhale. It's the stabilizer, it's the transverse abdominis. And then when you curl up, rectus abdominis, good. Slowly coming down, slowly coming down. Elbows open up. So now, we want to keep the spine still when we land here. And to do that, you want to keep the pelvis like it's anchored, the SI joint like it's anchored in the ground. And just with your leg bones, you can rest your hands here at your side so you feel that the pelvis stays still. And you let your knees go side to side. And this is true hip range of motion, right? Our true hip mobility tendency is we start to twist to allow for more hip mobility. So here, go slow, even close your eyes, and slowly bring your legs left and right, keeping the pelvis really still. Feel the edge of your range of motion. You go up to that. See if you can keep your breathing and avoid any cramping or straining. But you rotate with engagement, with connection, and then slowly come on out of that. A few more times each direction. Try to stay relaxed in your spine and in your body, but stable. Pelvis stays still. And you're moving the leg bones side to side. Good. Just getting to notice that this is my true range of motion. Okay? Moving left and right. Okay, good. Next, when your legs come back to neutral, you're going to take your right leg, point that up. And a few times here, you're going to rotate this leg bone. So the leg's pointing up. You're going to roll the leg bone open and roll the leg bone closed. Stirring in the hip socket. So you want to stir this hip in and out. So it's all coming from here. My foot's not rotating me, my knee's not rotating me, but I can feel the thigh muscle spiraling from the engagement on the top of the leg bone and into the low back. Okay? Turning that like a rolling pin. Good. Next time you externally rotate, that means your toes are pointing away from your body. But externally rotate, and you're going to bring the heel down. When your heel comes down on your foot, you're in this figure 4 position. You're going to take your right hand and place that on the inside of your thigh. You need to bring this other foot up. So what we're going to do here is get this little tug of war going back and forth. I'm going to push with my hand into my leg and push my knee away. My knee is going to meet that resistance and push back into my hand. Hand will allow. It's just going to allow the knee to push inward. So engage the inner thigh. Go as far as you can. And then keep this pressure with the knee into your hand, but push away. And watch yourself, you're lengthening out these adductors on the inside of your thigh and opening the hip up. Okay, so now with awareness, you're closing your hip up internally, right? This is adduction, drawing in, you're giving yourself some resistance. You stay with those adductors, stay with it, feel the inside of the thigh, but allow it to move open. Keep your breath, keep your breath. You're opening up the inside of the thigh. You'll feel that your range of motion will start to increase out the more you do this. In, out. In, out. Good, one more time. You're flossing through, really trying to work on getting these rotational muscles deep in the hip to be active, but also to be passive so that they can lengthen out. Feeling the muscles get longer and longer. Good. And that rotation opening up. Nice. Now, you're going to take your hands, and you're going to shoot your hand through this gap here and catch your knee. If you can get through, right, and clasp the hands here, that's great. If you could just reach behind the leg, you could be there, or you could just hold the shin. Either way, you want to keep the thigh and the ankle connected. You could be through here, fantastic. You're going to draw that in. Again, now this is with the outside of the thigh. I'm pressing my ankle into my knee to push away. And then my knee is drawing the ankle in. Ankle presses the leg away. And then drawing that in. Working on the outside of the leg, right? And then IT band, TFL, external rotators. Good. One last time. Nice. Straighten out both legs up towards the ceiling. Point and flex the toes. Roll the ankles, roll the feet, move your toes, move your feet. We get a lot of tension that builds up down here. One thing that I cover a lot is foot health. There's so much of our fascial bands and systems, they run through our feet, they connect into our feet, and tension builds up here. It echoes throughout the rest of our body. All right, let's bring this right leg down. Left leg up towards the ceiling, and you're going to roll that like a rolling pin. All your focus wants to be in your hip socket, stirring this in and out. Right? This is great for when you're trying to cut angles and do arm bars. If you can cut this angle well, it helps your upper body follow. So you want to have good rotation through your hip to help you accelerate and move other directions. Right? If we're trying to do this with just all core and not the fascial chains that connect into our core, then we're making a big mistake. We want to use our whole body in our movement, and this rotation of the hips is great for getting your lateral flexion really going in your core. Good. Stirring and stirring. Good. Now take this left foot, left ankle, place it down on your right thigh. Take your left hand, place it on your knee. You're going to do that tug of war here. Tug of war, a little pushing, shoving. You're going to push into the knee. Knee resists, then the knee wins, right? Knee starts to win. It brings your hand towards your chest. And the hand wins, and it starts to push the knee away. Just the right amount of resistance is so you can feel into this connection where the inside of the leg meets your torso. Time or two here. Flossing this left leg. Back and forth. Stay connected. Don't rush it. Don't force it. Just try to move smooth. Move nice and smooth. Stay connected. Great job. Good. Now we're going to try to get the other side of the thigh. So you can just hold here and bring that in. So this leg is pulling into the ankle. The ankle's pushing away, right? This leg's pushing away. This one's pulling in. So a little resistance. But you gotta let one side win and then the other side win. If you want to grab the back of your thigh, you can grab the back of your thigh. If that starts to get a little open, and then you can reach all the way through, holding here. Rocking back and forth. Stay active in that left hip. Staying active, connected. Nice. One more time. We're going to do one more time here. Coming in, letting that go. Good. Let's do a few one-legged bridges here. So we'll get the other side. We'll do this side first. You're going to take your right foot, bring that down onto the mat, left foot on top of this, and you're going to bridge up. This is pressing down. This is floating up. You can slow come down. When you come down, let's add a little curl under this. Curl your right elbow up into your left knee. Come down. Arch up into a bridge, bridging the hips up. Slowly come down. Try to slow come down, come down. You come down. You land. You exhale. Engage your core. Roll up. Come down. Lift up. Coming down nice and slow. Good. One more time, each direction. Floating up. One-legged bridge here. Hips are still neutral and stable. Slow coming down. Curling up. Good. Release the left leg down. Take the left arm, bring that behind the head, right arm down the side, right leg up into the air. Bring the right leg over the left thigh. Left foot plants into the ground, floating up. Coming down. When you come down, you curl. Try to flatten the back down, curl in. It's a diagonal curl. Floating up. You want to also try to use this right leg to help lift you up by pressing down to the top of the thigh. Slow coming down. See if you can stay connected. Relax through the hip. One last time. Float the hip up. Slow coming down. Good. Land. Bring both feet down onto the ground. I'm going to open the legs, close the legs. Okay, we're going to connect this curl into this now. On an inhale, you're going to open your knees and arch your back. On an exhale, flatten the back down, bring the legs together and curl up. Slowly relax that. As you inhale, open the knees, engage your glutes, squeeze around your hips, arch your back. Relax around the hips. Exhale, squeeze the insides of the thighs, the insides of your hips. Slow release, slow relax. Open the knees, open the elbows, arch your back, engage your glutes. Try to squeeze around your hips. Slow relax. Knees and elbows together, curling up. Slowly coming down. One last time, each direction. Really feeling these hips. And when you open or when you arch your back, right, extension into the glutes, into external rotation. Relax that. When you flex the spine, engage your front body, your legs internally rotate. Slow release, slow relax, slowly release. Good. Slide the legs long. Lay the arms out long at your side. Give your legs a little wiggle, your body a little shake. Kind of shake yourself loose, let everything kind of jiggle around. Do that good Etch-a-Sketch, right? Imagine you're that Etch-a-Sketch and you're shaking that, all those old drawings, all that old written patterns, all the written information from the days, the weeks, the months before. You just got to shake all that off. Pausing back here in neutral. Letting yourself be still. And allowing yourself to lay here, relax here, letting yourself integrate all that movement. Letting your mind take a pause, your body take a pause. Just feel the breath going in, going out. Great job today. Way to take care of those hips. Keep working on your mobility. Keep practicing. You'll see the results. Thank you for working with me, and I'll see you in the next class.